number of respiratory illnesses around, and this has been going on for some weeks now. And I'm seeing cough, catarrh, sore throat, fever, headache, body ache. We're seeing it a lot more now, and even fatigue. And I even have some people complaining about just feeling weak. And you just hear more and more of these over the last few weeks. The the problem, because I know today's topic is COVID back. The problem is that a lot of these symptoms are not specific to just one disease. And I think we'll talk more about that later. But a lot of different diseases can produce the same picture. And then, there's another issue in Nigeria. Somebody has a fever on Monday. That means by Tuesday, they're starting anti-malarial. By Wednesday, they may add some antibiotics. By Thursday, they're taking 5 different medications. And we don't really know, has anybody even established a diagnosis? So we've been trying to focus on truly establishing diagnosis first before treating. But there's enough respiratory illness going around for us to pay attention to it and to talk about
You've booked Nigerians down to a T. Today
it.
anti-malaria, tomorrow and it happens almost everywhere. Even amongst the enlightened ones, you see them do the same. Anyway, based on your clinical experience, should Nigerians be concerned?
That's a good question. Um, you know, the concerning question is COVID back. The way I like to answer that is COVID never left. It's not like we cured it and eradicated COVID. It still has continued to circulate worldwide. And what actually changed was that the population developed immunity towards it, which is why we didn't see it as much. Previous infection and to a small degree vaccinations have helped us manage the disease. But I understand there's a reason why people are asking that question again. But it's entirely a reasonable question, but it never left. So it's hard for me to say it's back again. But we are seeing symptoms that are similar to COVID like symptoms. And the other complication is that, since the pandemic, we don't test for COVID as much today. So I searched before for this topic. I searched through NCDC, the Nigerian Centers for Disease Control, looking for their statistics, and we don't have really great statistics. So it's hard to say it's another COVID wave, but it's good for us to talk about it. So if we see some of the symptoms, we can at least test for it before we start calling it COVID or COVID-19. But it's not the only possibility. There's things like the flu, the common cold, even malaria can look like respiratory illnesses. So my message is be alert, do not be afraid. No need to panic, but you don't dismiss it as well. COVID never disappeared.
That's pretty much fair. You mentioned the flu, the common cold, and maybe even allergies. How can people tell the difference, and why is it important not to self diagnose?
Yeah, people can tell by looking at the symptoms. If we talked about, you can have viral upper respiratory tract infections. You can have the flu, COVID, allergies, sinus infections, what we call tonsillitis or pharyngitis. One of the one of the things that Nigerians do, and a lot of people do this around the world, is that when you see yellow or green or dark or colored mucus, like, oh, I know what this is. This is bacterial, but it doesn't have that. There's a lot of overlap between the different diseases. So, like influenza or the flu, often starts with fever, chills, headache, and some body aches. But what else does that sound like? Malaria, right? So the common cold is usually milder. People have runny nose, sneezing, congestion, sore throat, and things like that. But allergies too. The only difference is that usually you don't have the fatigue. You'll have the itchy nose. You'll have itchy or watery eyes. You can have sneezing and nasal discharge. And then if we're now talking about COVID, you can add sore throat. I don't know if you remember back during the pandemic, people used to lose their sense of smell sometimes, but it's not guaranteed. So it's difficult to just go on just symptoms to tell exactly what that person has.
Okay, so when should someone with cough, catarrh, or fever seek medical attention instead of treating themselves at home?
Oh well, if it lasts for I usually tell people 24 to 48 hours, or I'll give some better warning signs. You know, if you have difficulty breathing, that's not something you want to waste time about. If you're having significant chest pain, right, or you're having confusion or uncontrolled coughing, those are signs, or heavy or high fever. Those are not signs that you should ignore at all.
All right.
But if it's mild, it's not really keeping you from going to work or school. I usually give people up to 72 hours because a lot of times viral infections, which we don't, antibiotics do not work for viral infections, right? So viral infections are usually self-limiting, meaning your immune system will take care of them within about 3 days, maximum of about 3 days. Anything goes longer than that, then you should definitely seek medical attention. Or if you have any of those other symptoms I mentioned earlier.
All right. We are
Oh, can
live
I
on.
add one? Sorry, because
Okay,
I've been seeing this coughing of blood. I know it sounds like a no brainer that if you cough blood, you should go to the hospital. But I've had some patients recently in the last 2 weeks coughing of blood, and they were at home just watching it. They said they wanted to see if it will go away. Coughing of blood is never normal. If you cough blood, you should please come and see your
the first
doctor.
thing that would come to my mind if someone is coughing out blood is tuberculosis. And
Yeah,
I don't
that's
know if
fair.
it's always true, but that's the first thing that will come to my mind. So to the hospital straight. No wasting
Exactly.
time.
Exactly.
Anyway, it's 18 minutes past 10 this beautiful Friday morning, and we are live on YouTube at WFM 917. And you can listen to us on the go via our website at www.wfm917.com. We have Dr. Ajayi Abiola today. And you know, Dr. Abiola is always ready to answer your questions. He doesn't frown, he's always cheerful. So you can call on 07000 or 09155 or 0800 917. Okay, so Dr. Abiola, which groups of people are more vulnerable to complications from respiratory infections?
First people I think about are babies or very young children. You know, they have, so you think about people that have low reserve that cannot really take serious illness. And of course, babies, young children, and then the other side of it, older adults, you know, people 65 and over. Of course, we have to add pregnant women in that group. So those are the most vulnerable groups. But when we now break it down a little bit more, you look at people that, of course, have asthma. Somebody that has asthma, if they get a respiratory tract infection or respiratory tract illness, and put them into an asthma attack, that person could possibly be very sick or die because they've now gone into a serious attack. So if you have asthma or you have chronic lung disease, you don't want to ignore symptoms for long. Then people that have in medicine we say comorbidities, meaning other chronic illnesses that are associated with them. For example, high blood pressure, diabetes, liver disease, kidney disease, cancer patients, you know, or anybody that has a disease that can suppress your immune system, like HIV, etc. Those are the most vulnerable people. But anyone can get it. But these people are this group of people are definitely the most vulnerable.
Okay. When is COVID-19 testing necessary and who should consider getting tested?
Well, we talked about some of the symptoms, you know, fever, sore throat, cough. We also talked about severity, you know, things you're having difficulty breathing or coughing up blood. So, of course, if you have any of those symptoms and they're not seeming to go away, then definitely should get tested. If you have a known exposure, maybe you've been around somebody that had COVID, right? That had diagnosed COVID, of course, you should be tested. And if you have anybody in the household that has a similar type symptoms, they should also be they should also be tested. If you have a cluster, like if you notice that maybe you work in an office or you're in school and you see like large groups of, clusters, meaning groups of students or groups of teachers getting the disease, getting the same kind of symptoms, that may be a good reason to test. Like if I have contract with a school and I see 10 teachers in a month that have these severe upper respiratory tract infections or illnesses, then I'm going to definitely consider testing them. And then, we talked about the vulnerable age groups and the vulnerable people. So any of those, you immediately want to test. I don't want to, have a 90-year-old that has a respiratory illness and I'll just be watching. Anybody that's high risk should definitely be tested. And the other one is another thing that we do often in Nigeria and around the world. We're waiting at home for either home remedies or the drug the chemist told us to take or what our friend or our neighbor told us to take, and we just think is going to work. If your symptoms are significant or they're worsening, then please don't do that. It may be time to do additional testing.
Hmm. What you said about most times waiting at home for the symptoms to pass. Sometime in 2022, I couldn't breathe. I couldn't
Mhm.
swallow. I couldn't even talk. But I was going on with gargling with salt, taking honey. After some time, my mother just said, go. I was in the university then. She was like, go to the hospital. I was like, it's just normal sore throat. Why should I go to the hospital? Then I got to the hospital. The doctor did a series of tests and he said I was so lucky I came then. If not, my voice box would have been damaged.
Mm-hmm.
I had
That's
an infection and I continue to force myself to speak, continue to force myself to be active. Since then, Dr. Biola, when I have any issue, I go to the hospital straight.
good. I love that.
Forget home remedy. Because it's imagine if I had lost my voice box, if I couldn't talk again, I wouldn't be here.
Very true.
I
Very
wouldn't.
true.
So I guess we Nigerians, we need to learn when to be able to seek help. We shouldn't always say we have one herbal medicine at home or we know home remedies. But anyway, I'm not the doctor here.
Well, you're
So
giving good advice. That's perfect advice. Perfect.
if someone tests positive for COVID-19 or another contagious respiratory illness, what steps should they take to recover safely while protecting others?
So there's a important thing that you mentioned in that question is
Mhm.
COVID-19 or another contagious respiratory. So we should treat them the same because if I have 10 people that have a respiratory illness, probably maybe one of them maybe possibly COVID. And most of them are going to be something else, but they're all contagious, right? So you want to rest, you want to stay hydrated. I see a lot of people just not drink any water. And hydration is water. It's not there's a drink called Boost. I won't use the full name of it, but that's sugar water. That's not really meant for hydration. Sugar water actually dehydrates you. Water hydrates you, right? And then you can use other treatments, but you really want to stay home where if it's practical, you want to avoid those vulnerable people. So if you have COVID or a contagious respiratory illness, you don't want to be taking care of your sister's infant or newborn child, right? And you want to stay away from elderly or those that are already sick. Another thing that's useful is improving ventilation. So opening windows, having air circulate will definitely make you feel better. What a lot of people I see it outside. That's why I don't shake. I used to shake everybody's hand. I'm coming from the US. We shake hands and we hug a lot. I don't do that. I don't do that as much anymore because I see a lot of disturbing practices. I see a lot of people not washing their hands regularly, which is very important because you're trying not to transmit diseases. You can transmit a disease without you having the disease. For example, if I'm a doctor and I'm treating sick people every day, and I don't wash my hands regularly, I can transmit diseases to other patients, to my family at home. So washing your hands regularly is very, very useful. When people coughing into your hand is a no-no. You're supposed to turn away and try and cough into your you understand it makes a difference because you want to keep your hands as germ
Able to
free
get into
as,
your sleeve. Or
yeah, into your armpit or into your elbow, off to the side, so you can trap it there, and then you can go and wash later. And if you have to be around other people, we can still wear our masks. I'm sure people have COVID masks
I
somewhere in
don't
a drawer.
I don't even have any.
I'm sure they haven't all disappeared. So I saw somebody wearing one last week. But you just, when we say contagious, they're usually contagious through something called respiratory droplets. So if you've ever gone up to a window and breathed on the window, you see it fogs up. That's moisture, and within each drop of moisture, you can have bacteria, viruses that can be transmitted to other people.
Okay. What is your advice regarding COVID-19 vaccination and booster doses, especially for older adults and people with underlying health conditions?
I'm not the best person to ask this question because the answer I would give is politically incorrect.
Hmm.
I will have to reserve because I don't want, this is going out on the internet and going, and I don't want people to say that I'm against nationally or worldwide strategies, but I'll have to plead the fifth on that question.
Okay. I also
I cannot comfortably say yes or no. Let me put
I
it that way.
understand you because there are many things I don't always want to say. So I either paraphrase or I skip,
Yeah.
and it's totally fine.
If
Anyway,
somebody asked me personally, did I take the COVID vaccine? No, I did not.
I understand. Okay, so parents are often worried when their children develop coughs and colds. When should they be concerned enough to take their child to the hospital?
Very important to look at the child that may have that cough and cold. You want to identify things that would suggest a child is having trouble breathing, and it's fairly simple if you know what to look for. If I would take your kids, clothes off, look at the bare chest at least. If you see that they're breathing very fast, faster than normal, that's a sign. If you can tell they're having difficulty breathing, sometimes they'll flare their nostrils really wide because they're trying to get more air in. If you see that they're breathing more from the chest and you can see like the ribs are also getting involved, that's the sign of difficulty breathing. Of course, if they have a high fever, right? Another one you will see is that the lips will change color. If the lips they turn like bluish or purplish, of course, if they have any seizure or convulsion, all of these are signs of severe illness, and that patient should be in front of a doctor as quickly as possible. If you notice that your child is not urinating as much, if you're wearing diapers and you're not changing diapers as regularly as you used to, or you're seeing that not as much urine is being produced, that's another sign, either sign of dehydration or another serious illness, right? Of course, if your child stops feeding, or doesn't feed as much or as often. These are also great signs. And if you notice that child is excessively sleepy, sleeping more than often. So most people, they take care of their children. They have to take care of their children every day, right? So you should know the patterns. And if you start seeing things that are out of pattern, it could be a sign. A lot of them can't tell you, hey, I'm sick or I'm feeling this way. So you have to look at the signs and you have to notice anything that's out of the ordinary, especially the things I just mentioned. Good reason to have them checked out by a doctor.
Okay, Dr. Abiola is saying for parents of infants, you have to be very observant. Watch your child, observe patterns, and seek help when needed, basically. All right. Hmm. You mentioned people washing their hands and maybe wearing masks. So, what other simple preventive measures can individuals and families adopt to reduce the spread of respiratory infections?
The we talked about washing of the hands. I
Mhm.
don't know if I have to make it clear, but it's not washing your hands just when you want to. You want to wash your hands, of course, when you come in and out of the bathroom, when you're touching a lot of publicly used things like door handles, you're going in and out of public. We've talked about how to cough. I think one of the main things is if you have persistent symptoms, try to separate yourself from others until you have a diagnosis and you're under treatment. If you have pneumonia and diagnosed pneumonia, maybe you've done a sputum culture or a spit culture, and you're on antibiotics for 5 days or 3 days, you're now less infectious. Still wash your hands, still watch how you cough and sneeze, but if you're not gotten to that point, you really want to try and avoid gatherings or places where there are a lot of people. Those are some of the easiest ways for respiratory infections to spread, is when you spend a long time in a poorly ventilated office. You now infect other colleagues. Those colleagues take it home to their families. They now spread. You see, this is how pandemics start. So we all have to do our part.
Okay. Many people continue going to work, school, or public gatherings despite having flu-like symptoms. What are the health implications of this?
Yeah, that's one of the like I just said, that's one of the easiest ways for respiratory infections to spread. You know, the when the pandemic first started, we thought that somebody flew from Wuhan on a plane and now spread it on the plane, and all those people went separate areas. But if all those people on that plane went home by themselves and stayed at home for 2 weeks, the thing would have died there. Either they would have passed away or they would have got immunity and survived. But they went to work, they went to social gatherings, they went to home, and that's how things spread. Same thing happens in classrooms, on the bus, these public buses that we were forced to take at times. You see how close people are, packed in together. It's part of it. Churches, mosques, social gatherings, it's all the same. If I have a if I have an organization and I have a sick employee, keeping that one sick employee at home briefly may be much less disruptive than having 10 employees sick the next week. So it's not, a lot of some employers will look like, no, this person is not that sick, but I'm looking at the other people. I don't want all the nurses to get sick, right? I don't want all the doctors to get sick. So if I have somebody that has maybe something that could be possibly contagious, go home for a few days, and so we can protect everyone else.
That's pretty much fair. Fair, yes. How important are good nutrition, adequate sleep, regular exercise, and hydrate? Oh, you've mentioned hydration, but
Mhm.
yes, hydration in supporting the immune system and recovering from respiratory illnesses.
I know we've not done many shows together, but I know you've heard about me. This is one of my big things, nutrition, right? So it's important. It's very, the simple answer is very important, but it's important to know that there's no particular herb or fruit or vitamin that suddenly makes your immune system invincible. The immune system functions best when your overall health is good. You're getting adequate sleep. Sleep is by far one of the most important things you can do for illness and just being healthy, right? Getting adequate sleep, because your immune system is most active during when you're sleeping. And if you don't get adequate sleep, it actually depresses or reduces the effectiveness of your immune system, which can lead to more problems. So adequate sleep. We talked about good hydration, right? I am Now, I mentioned there's no particular vitamin, but vitamins and minerals are extremely important. And we get vitamins and minerals from vegetables, right? So I am a big believer in protein and vegetables. Protein helps support your body's functions, and vegetables have zinc, the magnesium, the potassium, all the different things we need to run the enzyme, to run the body's processes, right? So you want to not eat processed foods, things like, can't name the brand names, but these snacks that have just dough and a sausage in the middle, things like those have very little nutritional value, and they're not going to help you as much as protein and vegetables. If you don't eat meat, beans have a lot of protein. And one of the things patients know, if there's any patient watching this that has seen me, most of the time I will do a diet and nutrition or lifestyle guide, and I'll create one per patient and send it. It's not generic. I tailor it based on if you have high blood pressure or you have diabetes or you have the flu. I will tailor your nutrition. I even do like a 7 day meal plan because that's how important I think this is. So the other thing is you'd be surprised at much exercise helps, right?
Hmm.
Regular exercise helps because it improves your immune system. And really, if we if our immune system could solve all the problems, that's the best way, better than using antibiotics or all these different drugs. It'd be nice that if you have any kind of infection, your immune system can handle it, right? So that's and then I'll add another thing. If you have diabetes and you have poor blood sugar control, you are at risk for having diseases that maybe if we're talking about respiratory illnesses, it can just be that much worse, right? We already know that bacteria love sugar. So your blood sugar is high, they're going to love that. As well as if you're not controlling your diabetes or your high blood pressure well, it's putting stress on your body, which depresses your immune system and just makes things worse. So you want to have good control of any chronic illnesses you have. And two no brainers, but I have to say them: avoid smoking, avoid alcohol.
Hmm.
Right. But
Yes.
if you have an acute illness, acute meaning it just started, and it's febrile, meaning you have a fever, then the first most important thing, yeah, of course, get it diagnosed, but adequate rest, adequate hydration can't go wrong with that. I'm not saying sit at home just sleeping and drinking water. I'm saying that those are part of the treatment plan, and they're very, very important.
All right, Dr. Abiola, I'm going to ask you a question, and it is not related to COVID-19.
Okay.
We talked about the immune system now. What do you have to say about a child who was born with, is it a low or weak immune system? Despite every avenue tried, the child's immune system is basically non existent. The person is grown now, doesn't smoke, doesn't drink, tries to eat healthy, and this child has had tuberculosis before. How can we help the person?
Well, the first thing I would want to know, or the first thing that can do to help that person, is try to figure out why they have a weak immune system. For example, now your immune cells are made in your, a lot of them are made in your bones, in your long bones. So does this person have what they call aplastic anemia, meaning they're not making, the anemia meaning low blood, but aplastic meaning the cells that create immune cells and create these other cells. Are you making too little of them? Is it that your bone marrow is not stimulated enough? Because there's drugs we can give to improve that. Or do you have a T cell? T cells are cells that go around and mark and also help mark infected cells or viruses and bacteria. So do you have a T cell deficiency? Do you have a B cell deficiency? We need to, and these are things that we can actually test for. And then I'm always a big believer of if you know the problem, it's going to be easier for you to solve the problem, right?
Mhm.
So I love the fact that they're drinking, they're hydrating, they're sleeping well, and all of that. But we need to know, do they have any other comorbidities, sickle cell, right, or something else? And if we now manage those comorbidities, you'll see their immune system will probably improve. But after I answer that question, then I will now more than likely I'll also do some supplements. I'll introduce a spare degree of supplementation.
Hmm.
I take dietary supplements every day. I don't. There's not a day that goes by that I don't take my supplements, and I feel like it has improved my life. Even though I know I eat well and I do that, I feel like it can't hurt and it can only help.
Okay, thank
That's a
you.
good question. Good question, though.
Mhm. Social media is filled with conflicting health information. How can people identify how can people identify credible medical advice and avoid misinformation?
This is one of the difficult things, or one of the things I don't want to say I hate. I don't mind in anything, but one of the things I see often, right? You should ask yourself who is giving the information. Is it just, some people would say just because the person has a lot of followers, everything they say is true, which is insane to me. You may have a housewife that, and I'm not saying anything wrong about housewives. I'm just saying you may have a housewife that has 2.5 million followers that tells you if you squeeze lemon juice on your head, that will protect you from COVID-19. Who told you, right? What are their qualifications? How are you qualified to even give medical advice, right? Then what we are taught in med school is something called EBM, evidence-based medicine. So the reason why we give paracetamol for a headache is because we've tested it against 1 million patients and we saw that it works, right? So what evidence are they using? And you can finally, if you know who's giving the information, what are the qualifications, what evidence, then you can now compare it to reputable medical and public health organizations. Like I said, I researched in the Nigerian Center for Disease Control before I came on this show just to see what they're saying. I I always look at WHO, World Health Organization. Now, these organizations could be wrong, but usually they're trying to give you information that makes sense. And usually they're trying to give you information that is evidence based. So the final thing I will say, and this is for my Nigerians, is that you need to be particularly suspicious of miracle cures. Only God provides miracles. And I believe my life is a miracle, but I don't go through life expecting them. And I definitely don't take them from other human beings. So if somebody says, no, take this pill and it will miraculously make you taller, I'm going to be suspicious, at least a healthy dose of suspicion from that person. And I see this often. I have patients that, will come, I've diagnosed them with, maybe prostate disease, and I've given them some diet plan and some medication. And the next time they come back, they come with this bottle of something, something, something. I'm like, oh, they say, doctor, can I take this? At least they ask. Some patients will ask before taking it. And if you cannot ask those questions, who's giving the information? What are the qualifications? What evidence are they using? Take it to your doctor and ask, right? But when I now ask, oh, where did you come across this? Sometimes I see it, I have no idea what it is. I have to start researching it right there in my office. Oh, I saw it on TikTok. Oh, I saw it on Facebook. I'm like, you bypassed the information from your doctor and you now went to TikTok looking for a remedy. You have to be suspicious about those. If those things really, really worked, wouldn't they be sold? Wouldn't they have a NAFDAC number? Wouldn't they be in a pharmacy? Right? Isn't that how you make millions and billions? That not it's not by just selling some random stuff on TikTok. You may find something that works, but it's so few and far between. And the thing is that there's potential for harm. You can find some things that can harm you. You don't know how it was made. You don't know exactly what's in it, and you can take it. I've had people take stuff and affect their liver. I've had people take stuff and affect their kidney to the point where they had to be hospitalized. And it took time before they now finally admitted, well, I did take something that I saw on Facebook. Really? So, just take your life more seriously than that. And if you have questions, ask qualified healthcare professionals, and at least start there and have a healthy dose of suspicion. That's my best advice.
Hmm. Some people, it's the well meaning aunts and uncles who give them different things to drink or to put on their body, thinking it would work. But anyway, all the best
When
to
I
you.
get if I get things like that, I will accept it. Thank you very much, and I put it on the shelf. I'll I'll research it before I even consider putting it close to my body, let alone in my body.
I don't know if
You don't have to be rude, but treat your body, specially.
I don't know if any of my aunts might be listening to me. So I'm not going to say what I do with things they give to me.
I think I have an idea.
Finally, what practical advice would you like to leave with our listeners today to help them protect themselves and their loved ones during this period of increased respiratory illnesses?
Well, I'll start with our topic. Is COVID back? COVID never completely disappeared, and respiratory illnesses are apparently going up. So it deserves to be considered, right? And if you have a persistent illness, don't panic, but try and get it diagnosed. And the one of the most important things in our environment here is don't automatically diagnose everything as malaria or typhoid. This is what we love to do. Any sickness is malaria or typhoid. Malaria or typhoid. It's one of the first things I noticed when I moved back to Nigeria. Everything cannot be malaria and typhoid. So if you have questions, you need to go get to the doctor so you can do some testing. Do not automatically walk into the chemist and just start taking antibiotics for cough and catarrh or whatever symptoms you're having. One, you can increase what they call resistance in the community, where antibiotics will eventually stop working for all of us, and that affects all of us, not just you. And two, everything has side effects. So if you're taking antibiotics for a viral disease, you're just punishing your body for no reason. And, please don't assume every respiratory illness is COVID either. In our lab here, we can test for COVID in like 15, 20 minutes. It doesn't take time. So if you're worried about it, don't assume, right? There's a saying, if you look at the word assume, ASSUME, if you assume it makes an ASS out of you and me, right? So I like to tell people, I like to tell people, please don't assume.
God, you left me speechless, Dr. Abiola. Anyway, you always have goodies for us when you come on the show. Do you have anything for us today?
Sure. If anybody is worried about their respiratory illness, we'll run a test for you. A test called full blood count. That looks kind of gives an idea if it's bacterial. And
Mhm.
if we have the suspicion that it's COVID, we'll run a COVID test for you. I'll do the first 25 people. But you have
Hmm.
to say you heard us on WFM and be pleasant. That's all.
Yeah, be pleasant.
Be pleasant. Always be pleasant.
How can we reach you, Dr. Abiola? Your email, your phone number, anything?
Yeah, I give out my actual phone number 0913 579 5108. Say it one more time 0913 579 5108. If I'm in surgery or I can't answer, just let it ring. My PA will pick it and just tell them what you need. And then look at us on socials. I'm heavy on social media, so our website is theVROAhospital.com, and we're ROA Specialist Hospital on all your major Instagram, Facebooks, Twitters, and X. And we're there. We answer questions on our Facebook page, our Instagram page. We do all of that. I will not treat you on Facebook. I'm not going to write a prescription because that's unethical and that doesn't make sense. But I'll answer questions and give you directions. And usually, if it's more serious, we invite you in.
Or
Thanks for having me.
thank you for coming on the show today, Dr. Abiola.
My absolute pleasure.
Hmm. My name is Hassane Matula. Have a lovely, is it morning? Yes, have a lovely morning.
Take care.